Blank Children's Pediatric Clinic is made up of 13 providers, which includes nurse practitioners as well as physicians. I have over 40 clinical staff and clerical staff that support that practice. We have 35 exam rooms, and in any given day, we see over 200 kids a day by 8 or 9 providers. Our hours are Monday through Friday, 8 a.m. to 8 p.m., and on Saturday and Sunday from 10 a.m. to 3 p.m. We see and treat newborns to kids in their early 20s, depending on their healthcare needs. We serve the state of Iowa and actually have families that travel from out of state to come and see us at our clinic. In 2016, the journey of national recognition for patient-centered medical home began. What was the most proud moment for me as an administrator was when I realized, looking at all of the criteria, that we were doing so much of it already. Achieving recognition reaffirms what I already know. Our providers and staff provide the best care every patient, every time we have the privilege to serve them.
Huddles were a real challenge for us at first. A little bit intimidating, trying to get everybody together and to be able to talk about issues that we were having. Now it's become something that we do automatically. We get together, we talk about the schedule, we talk about the patients that are coming in, we plan ahead for what's going to happen in the future. The staff has really stepped up and embraced this. The huddles are run by one of the nurses, different nurse usually each time, so that kind of goes in a round-robin sort of way. We also, because of the size of our clinic, we have 3 different huddles that happen during the day so that people who are working different shifts are still able to get to them and be a part of those discussions. It has really come together in a way that makes everyone feel as if they're part of the solution to helping with our patient scheduling management and also with their care.
As a patient-centered medical home, we strive for the best outcome for every patient at every visit. It is our goal to be the best that we can be and to give our patients everything that they deserve and need at the time they are here. We recently developed adaptive design process within our clinic, and it has been a very cool, exciting, challenging journey on its way, but it is helping to ensure that we are doing the best we can with our processes that we have in place to give our patients everything they deserve when they are here, and it is helping our patients as well as our staff.
Observing a huddle made me decide to join this team, a team that puts the children and family first in everything we do. Sometimes it's a simple thing like saying to a child, "I really like that Spider-Man t-shirt you're wearing." Here at the clinic we have a little red cart full of books donated by people from everywhere. We try to encourage the children to take a book home with them, not just the children that are here as patients, but the children with the rest of the family. And the kids really enjoy being able to take a book home and having something to read later on.
Patient-centered medical home is about eliminating siloed care. It's about making sure that we're communicating between teams, that we're collaborating and coming up with the best strategies to improve the care for our patients. One example is how we are trying to improve our HPV vaccination rates by coming up with strategies at each level where it is a collaboration between the staff, nurses, and doctors to make sure that the need for that immunization is recognized. We have a daily huddle so that we can get together and talk about issues that may arise, make sure that we're all on the same track towards providing the best care for our patients as possible.
The huddles are important because it provides a great time to coordinate our patient care and communicate about what our patients need, whether it be nutrition counseling, using it as a time to review medication lists with the pharmacy team, or providing education and teaching through the interpreter team. It's a good way to coordinate care and give the patients and families what they deserve. The change with the huddles has been good because it allows us to focus on the children.
One of our projects was to learn AID-IT. We were trained, we practiced, and we did it. This improved our patient experience scores. We did that. One of our expectations is to always use our name when we greet the patient. So at first that's a very hard thing to get used to, but once you start using it, it becomes part of your everyday routine.
Medical home initiative in our clinic has been really successful in helping us better address the social determinants of health, and we know how important all of the social determinants of health are at determining the long-term health of a lot of the kids that we see in our clinic every day. And so the program in particular called Connections has been instrumental in helping me help the families that I see each and every day in the clinic. One example of this is for kids that have an elevated body mass index. We know that that's a complex issue, and so being able to refer children to the Connections team, I've been able to help address family stressors that we know contribute to the issue. Also to be able to get kids hooked up with resources in the community that I wasn't even aware of prior to the Connections program starting. We were able to get children connected with resources at the Extension office to help families learn to cook together and eat healthier. And so overall that's been highly successful.
Trialing the rooming standards wasn't as difficult as we originally thought it was going to be. Change can always be difficult or a stressful time, but this one went pretty smoothly and the benefits and the outcomes were excellent. We had a large increase in our vaccination rates, and we also had more complete family history and patient care histories that we were able to focus on at each visit that they came in to be seen here.
Our patient-centered medical home journey began with the formation of an implementation team. And one of the first things the team looked at was how we were doing things presently and what we needed to change to meet the recognition standards of the NCQA, which is the National Committee for Quality Assurance. One of the first things we looked at to improve for outcomes was the rooming process. So the team worked together on rooming guidelines, rooming standards. And then as we formed those, then we rolled them out in small tested change to 2 provider groups. And once they were oriented to it, then other clinics, actually, other providers kept saying, well, what are you doing? Well, we want to do that too. So then we rolled it out to the entire clinic. And now we are all using the same rooming standards when we take patients back to be seen.
PCMH is not a physical place, it's an idea, it's a philosophy of care. It's about putting the patient at the center of everything that we do. And it's something that we've actually had here for a long time at Plank Children's. It's just something now that we're starting to seek some recognition for. It's something that I feel like has really improved our engagement through that process. The physicians feel like they're better engaged with that philosophy, and that improves our ability to care for our patients every day.
I'm so proud of this team. It was just 7 months ago that we started on this journey. While much of the work was already being done, we really didn't have the ability to capture the work that was being done and really no way to prove our patient outcomes. We truly discovered what amazing work this team was really doing. We've added new members to our team to improve our coordination of care. We've added My Unity Point nurse, we've added our visiting nurse services, we've added a psychologist, and we've added a PharmD to make us a more rounded team to coordinate the care of our kids. All of this has resulted in better outcomes, such as we've increased the number of patients that are using the portal. Our after-visit summaries that we print now are full of patient instructions, have health education in regards to maybe what's going on with this child, so mom and dad can read and share this information when they get home. We've implemented a scientific approach to problem solve, so we're not trying to solve the same problem over and over and over again. We've implemented some AIDIT type of initiatives to improve our patient experience. We have also standardized our rooming workflow, so every patient gets a BMI on every visit. Depression screening is getting done. We've improved our vaccination rates, and we've also improved the number of kids that we're seeing after they've been discharged from the hospital. This team has done an amazing job. They're truly dedicated to improve the health of our kids, and I believe that they will continue to strive for excellence in meeting the needs of the kids and families in our clinics.